start recording. And I'm going to welcome Dr. Cohen, Dr. Kasirye, and Rachel Allen to turn on their videos and join the welcome committee for our community on COVID-19.
It's not allowing me to start my video.
Okay.
The host has stopped it.
Oh gosh. There we go. You should be able to now. Okay. So welcome everybody to Sacramento County's COVID-19 Community Forum. Please don't hesitate to go ahead and start putting your questions in the Q&A that you can find at the bottom of your screen. And before we get started in answering your questions, what we like to do is have our team of experts here just talk a little bit about what's going on with COVID-19 in Sacramento County. So let's start with Dr. K, and then we'll get to questions after that.
Good evening, everyone, and thank you for joining us. So I'll just give a very brief update on where we are with the numbers, and then I'll turn it over to Dr. Cohen, and then Rachel will round off our updates. So we are at 156,531 cases of COVID-19 reported to Sacramento County. We are averaging between 200 to 250 cases per day. And our case rate is at 16.3. In the past week, we have seen an uptick in our cases. For a while, our numbers had been steadily going down, but in the past week, we have seen a little bit of an uptick in our cases. And also in our hospitalizations, hospitalizations increased from 176 to 199. So we are watching those carefully to see if there is something that's going on that might be causing this increase in cases. And this has been observed in other counties within Sacramento County. With the deaths, we're at 2,326, and we're averaging about 3 deaths reported per day. With the vaccinations, we are at 62.4% of the total population in Sacramento County having received at least 1 dose, and 57.4% having being fully vaccinated. And then statewide, in comparison, please note that the statewide numbers are actually for the eligible population. So there's a little bit of a difference for the eligible population, which is 12 years and above. 72.8% are fully vaccinated, and 80.6% have at least 1 dose. I will turn it over to Dr. Cohen, and then we'll go to Rachel.
Yeah, so thank you all, and thank you folks for continuing to invite me to participate. I'm trying to give the perspective of the people actively still caring for patients, and I think that the numbers that Dr. Kasirye brought up are not surprising to me. We've been stuck at UC Davis. We were going down. We never really got down super low, but we got down significantly. We bumped up just a little bit, not a huge amount, but we're sticking around. We still have about 44 patients in the hospital now. 30 some are active, and then others are just convalescing. Of that group, I will say that 8 have been vaccinated. Many of those are immunosuppressed patients. Most are not being hospitalized in the ICUs. If they're being hospitalized at all, we've also seen a number of our employees with breakthrough infections, or whatever the CDC is calling them now. And most of these have been very mild disease. I think that we've started already to see a downtick in the number of at least employees that are positive as the boosters have been rolling out. And so that has definitely helped. But I think this is sort of a little disappointing to most of us who are actively doing this, because this has been 21 or 22 months now, pretty much constantly. And I think the vaccine rates, as Dr. Kasirye brought up, are lower here than they are in the state as a whole. And although I think people are pretty good about masking, I've seen some big events where people are together in large numbers indoors, where there are a significant percentage of people unmasked. And so I think that there are just, and I'm a little bit worried about what's going on with the holidays coming up too. So we just ask everyone to be safe. If you haven't been vaccinated, to get vaccinated. And the hospital bed capacity is fine, but everyone's getting tired. We just as soon not take care of any more people with COVID-19 if we could get away with it. And I'll leave it at that.
All right.
I think you're up, Rachel. I'm sorry I didn't do
That's okay.
the introduction. I apologize.
Yeah, no worries. I haven't been on in a while, so I'll introduce myself. I'm Rachel Allen, and I'm the immunization coordinator for Sacramento County Public Health. So here with some updates on vaccines. We have definitely had some exciting developments in the last week and some that are coming. So wanted to be able to cover those for you tonight. Last week, more boosters were approved. Prior to that, only those who had had Pfizer could get a booster. So now individuals who've received an mRNA vaccine that are eligible can get a booster as long as it's been 6 months or more after their initial series. So that's for either Pfizer or Moderna. And those eligible populations are 65 years and older, persons 18 and over who live in long-term care settings or who have underlying medical conditions, and also 18 and over who live or work in high-risk setting occupations. So those folks can get a booster, but the other exciting news is that if you received a Johnson & Johnson COVID-19 vaccine, you can also receive a booster, and that's recommended for everyone who has gotten a Johnson & Johnson vaccine that is 18 years and older, and who have been vaccinated 2 or more months ago. And then another development is equally as exciting, is that the CDC has actually recommended and is allowing for some mixing and matching of the booster shot. So you get to essentially choose the booster that you feel is right for you after kind of researching and talking with your medical provider if you need to. But eligible individuals can choose which vaccine they want to receive as their booster dose. And there is some more information on that on our website. It's www.scph.com. And if you click on that website and then go to the vaccination tab, you can find more information. Public health does continue to do pop-up COVID clinics throughout the community. And right now we are doing dual flu and COVID clinics, which is a first for us. But we are offering first and second doses as well as boosters at all of our community pop-up clinics. So we would welcome people to come, and always reminding you, please bring your CDC card. Sometimes folks come with their digital record, but we're not able to update that for you. We really want to make sure we have your card and we can add the dose to it. And also keep in mind, boosters are not yet approved for those under 18. So we've had some folks excited wanting to get their teens a booster, and we're just not there yet. So these are for 18 and over. And then coming in the next few weeks, we do expect approval of the Pfizer vaccine for our younger children, which is also very exciting. I know a lot of parents have been waiting for this. So that would be for the 5 to 11-year-olds. The FDA has made that recommendation, but it's not approved yet. So hold on. The CDC still needs to look at that data. They'll do that next week. And then in California and the other Western states, we have our own review that looks at that as well before we're able to move forward. And it is a different packaging than the vaccine that we've been using previously. So it is being shipped out to locations, so it will be ready to go. But there is some time that needs to be put into training staff to make sure that they know how to utilize it. So we're going to roll this out a little bit more cautiously, hoping to look for the week of November 8th for our public health clinics. And then, just wanted to touch on what our role is in the rollout for this pediatric vaccine. We're working really closely with providers and partners, and especially pediatric offices, hoping that they are, prepared and ready to offer this vaccine to their patients. So that's a good place. If you have a doctor or a medical provider, that's a great place to go with your 5 to 11-year-old for a vaccine. But the state is also taking the lead in contacting schools and setting up some clinics at school sites as well. So that will be another opportunity for folks. And then again, we hope to have it at most of our community clinics as well. And that's it for my update.
Thank you, Rachel. We are aware of a technical challenge that folks are facing in accessing the webinar. The webinar link was shortened to a bit.ly link that is not providing to be accessible to folks. So we apologize if this is impacting your friends or family that are trying to get access to the webinar. I am actively responding to emails, providing a other mechanism to access, and I'll also put that in the chat momentarily. So this may be a shorter webinar for those of you that were able to join us that can ask those questions, and we'll still put this up on YouTube. And we appreciate your understanding in that sometimes we face some technical challenges and living this this Zoom engagement that we're doing nowadays with COVID. So we will transition over to the questions. We have a question from Courtney. Can you talk about the outbreak currently unfolding in Sacramento jails? Since many people cycle in and out of the jails, incarcerated people, but also staff, isn't the outbreak in the jails a threat to public health for all?
Sure, and just wonder, are you still able to hear me, Liz? Okay,
Yes.
Yeah, because the videos are frozen, so I wasn't sure. Yes, so last week we did report that we had identified a jail in both our CCC, an outbreak in our CCC and the main jail. And as of the last update, we have 41 cases reported in our CCC and 37 in the main jail. And what you said is right, that one of the challenges with jails, one is that this is a congregate setting, meaning that people are basically living together, and they're living in these pods, so they share a lot of airspace and spend a lot of time together. And so if COVID-19 is introduced into the jail, it can spread very quickly. And so that is what happened. The other thing also, as you mentioned, is that people do move in and out. We do have new people being booked every day, and then some people being released. And with every new booking, there is that increased risk because we know that there is COVID-19 in the community. The other area of risk, of course, is that the people who work in the jail do go in and out every day. And so they get exposed to the community at large. And so they can also introduce the virus into these communities. So there are a couple of measures that the jail has taken to try and minimize the risk. And one of those is that when an individual is booked into the jail, they are not put into the main population right away. They are put into a quarantine cell where they are observed for a period of time, which is equal to the incubation period for COVID-19, so that, and they're also tested prior to them being put into the main population. And then also for the workers, the inmate workers, they are required to either be vaccinated or they have to show proof of being tested on a weekly basis. And then with the people who work in the jails, the state did issue a mandate that they need to either be vaccinated and show proof of vaccination, or they have to be subjected to testing on a weekly basis. So in spite of all of these measures, and also in addition to that, masking, somehow COVID-19 was introduced into the jail. And so we do have a few pods that are affected. Public health is working very closely with the sheriff's deputies, as well as the correctional health. And we have frequent meetings to review the data and make decisions on any changes that need to be made. So one of the additional changes that has been made is a more frequent testing and more widespread testing, especially in the pods where we have had cases, so that we are able to identify those more quickly. And also with the workers, they do symptom checks with them, as well as the testing. We also continue to encourage the inmates to get vaccinated, and we also encourage the people who work in the jail to get vaccinated. And we're hoping that more people will take up that option, because that is the best way to protect everybody.
Thanks, Dr. K. Do you have any recommendations for businesses not complying with the local mask order in indoor public spaces? Some downtown property managers don't seem to care, and it's making me feel very safe, maybe they meant to say unsafe, returning to the workplace.
Yes, that has been a challenge from the beginning, because even though we do have a mandate for masking indoors, regardless of vaccination status, it is dependent on the businesses to enforce, and some of the businesses are better at enforcing than others. We don't have enough staff in public health to be able to go and look at every single business. We do have work with environmental management, which does go out to some of the businesses, plus code enforcement and provide education, but it has been a challenge. So sometimes people do make the choice that they will not go to certain places. There are people I know who have decided that they will not go to some events because they see that people are not masking. So individuals also do need to look at their risk. I think the most important thing each person can do is, one, get vaccinated, and then two, if people have symptoms, stay home. And the third one is make decisions on whether there are places that they should go or not.
Thank you. If the COVID vaccine for children gets approved next month, do I need to consult first with a pediatrician before my child gets a shot?
I guess I can take that. I think that's a personal decision. The vaccine, at least the Pfizer vaccine, was tested in I think 1,200 children. I think the Moderna vaccine, when that gets approved for kids, has been tested in twice or three times that many kids. And the safety profile has been really good, but I think that if a parent is anxious about vaccinating their child, I think speaking with their pediatrician is going to provide them the best information that they can get. So I would never say not to talk to your physician about this.
Sounds great. We have a community member that is wondering why the county and the media are reporting that everyone who is infected with COVID-19 is unvaccinated. This community member knows someone personally who is fully vaccinated and has now contracted COVID-19 a second time.
So I can speak to some of that. if they're reporting that nobody vaccinated is getting infected, that's obviously not very good reporting. The high percentage are, as I mentioned, in our hospitalized patients, maybe about 10 or 12% of the people who are hospitalized right now have been vaccinated. But, you know, there's a mathematical way of looking at this too. I don't want to sound too esoteric about this, but if you have a high percentage of people vaccinated, then anybody who ends up getting infected is more likely to be vaccinated, or at least there's a chance that that's the case. So for example, in our healthcare setting, if over 90% of our employees are vaccinated, then if somebody comes down with COVID, there's a chance that they're going to be vaccinated. But if 10 people come down with COVID and it's 50-50, then it's still overrepresentation of the unvaccinated. I think the key point, though, is the people who are in the ICU and the people who are on the vents are not the vaccinated people unless they have immune system problems where they're not able to develop good responses to the vaccine. So I think if the vaccine converts COVID-19 into a common cold, I think most of us would take that. I mean, we don't like colds, but we don't die from colds.
And just to add to that, on our website, if you go to the dashboard, we do have a tab for vaccinations, and it does show cases among those that are vaccinated compared to the people that are not vaccinated. So you can check up what the differences are. And also on the national level, what the data has shown is that, yes, people who are vaccinated can get COVID-19, but the risk is much, much less. And so people who are not vaccinated are 8 times more likely to get infected. They're 25 times more likely to be hospitalized and 25 times more likely to end up dying. So again, it's as Dr. Cohen said, that the vaccines are effective in terms of reducing the morbidity and mortality, or the seriousness and the risk of death from COVID.
Thanks, Dr. K. So Debbie is wondering, and no worries on joining late, Debbie. There were some technical issues, so thanks for emailing me about that, and glad you were able to make it. What's the difference between a Moderna booster and a Moderna 4th dose? Is the booster a smaller dose?
Yeah, so this 4th dose thing is something new. I'm going to bring that up in a second. Just to first point out, when you compare the Moderna vaccine to the Pfizer vaccine, the Moderna vaccine has about 3 times more mRNA in it. They both work equally well as far as preventing infection. The antibody concentrations generally are higher with Moderna than they are with Pfizer. And so over time, the decline may take a little bit longer to occur with Moderna. So when they tested their booster, they cut the dose in half. So the dose that we normally give is 100 micrograms of messenger RNA. The booster dose is 50. So they've cut it in half. The thing that I have seen, and again, this was brought to my attention today, so I'm glad somebody prepared me for your question. When we are talking about immunosuppressed patients, we don't really talk about the 3rd dose being a booster. we sort of look at them as having to need 3 doses of vaccine to get an immune response that is even close to what somebody with a normal immune system would get in 2. So I look at a primary series of mRNA vaccine for an immunosuppressed person to be 3 doses. And then the 4th dose would be like a booster for an immune competent person getting their 3rd. So the first 3 would be the full dose for an immunosuppressed person, and the 4th dose would be the booster dose, which would be half the dose. If that, it sounds like a lot of gibberish, but I think that I sort of went through that effectively, or at least I hope I did. So just think of if you have, let's just say, if you had a kidney transplant, let's just say that you need 3 doses out of the box. No one's talking about waiting 6 months to give the 3rd dose to a kidney transplant patient. But then 6 months from now, you may still get a booster dose, which would be the same size as a booster dose would be for at the 6-month mark for somebody with an immunocompetent system. If that isn't clear, just go back to the Q&A. I'll try again.
Thanks, Dr. Cohen. When will the state start enforcing testing for non-vaccinated? I read the B report. Why aren't non-compliant state employees being terminated like at the DMV, especially those that are customer-facing workers?
We do not have anybody on this call from the state, so I don't think we're able to answer that question. I know that sometimes the disciplinary process does take a long time. So it may seem as if nothing's happening, but they might be going through the disciplinary process.
Thanks, Dr. K. And I see a clarifying note from one community member around the unvaccinated cases relating to the jail. If you have a follow-up question, if you could just put that follow-up question specifically in the chat and the Q&A, so we know what your question is around that. Dr. K, did you want to?
Yeah, for the jail. Sure. For the jail cases, it is true that all the cases we have among the inmates right now, among inmates that are not vaccinated.
Got it. Why was the breast cancer event at the Capitol allowed to happen without safety requirements? There were over 10,000 present and most attendees were not masked, vaccination status wasn't checked, and there wasn't adequate signage or announcements. Aren't cancer patients and survivors at greater risk?
Yes, cancer patients and survivors are at greater risk. Right now, the guidance that we have from the state is that mega events such as this one are allowed to go on. There is guidance from the state as to what they need to do in order to make sure that individuals keep safe. And for some of the event organizers, they have actually checked in with us, and we've been able to provide them with that guidance and help them to make sure that their event is safe. But in general, what the guidance states is that for events that occur indoors, they are required to do vaccine verification, as well as vaccine verification or a negative test, and that they need to be masked. But these are recommended, highly recommended, but not mandatory for outdoor events. So I don't know whether this was an outdoor event, in which case that might be the reason why they did not take those measures. But I do agree with you that judging from the target population for this event, I think it would have been wise for them to take those measures into consideration.
Thanks, Dr. K. Is there any concern that we've reached a plateau as we are now seeing some increases in cases and hospitalizations? Are we expecting to have another surge?
Good questions. Yes, we have been on at a plateau for a while now. And as I mentioned in the last week, we have seen a little bit of an uptick in cases. We don't know yet whether this is just one of those things that happens where the numbers go up and down a little bit. But we're watching very carefully. We're hoping it's not going to be a surge because, as Dr. Cohen mentioned, I think everybody's exhausted. We do have some concerns as we're going into the holiday seasons, and a lot of people have gatherings, a lot of people traveling. So I think it's important for people to take every measure possible to protect themselves and their loved ones. And I think the most important of those is getting vaccinated. And soon we will be able to vaccinate children 5 and up. So I think that is something that would be important for people to consider. And then of course, others like wearing a mask, especially indoors, would be important.
Thank you.
Yeah, I would echo that. I'm hopeful that we're not going to see another surge. One thing that we do see a little bit of is that as part of this asymptomatic screening that's done in Davis and also done with our unvaccinated employees here at the medical center, when people have been getting infected, it's all been Delta still. So even though I know there's been a new strain that's sort of circulated a little bit in Great Britain, we are still only seeing Delta here, at least in the testing that I've seen. And the vaccine works well against Delta. And I think that's the one thing that we haven't seen is a strain that actually can totally end run the vaccine. I think that's what we don't want to see. That's when we would see another surge. And I think that, again, the more people vaccinated, the less likely this happens.
Thanks, Dr. Cohen. We'll circle back to the jail here. When was the most recent death from COVID-19 in the jails?
We have not had any deaths due to COVID in the jails.
Okay. I will just pause because I know sometimes it takes a little bit longer to type and open up for any last questions from the community that were able to join us. I apologize for the technical difficulties. Yes, so that's a great point, Debbie. Is this link going to work for the next meeting? I will work hard to make sure that it does, and we will communicate out and do even more testing than we did for this one to make sure that folks don't face the same barrier. We will not be having it on Thanksgiving Day as it has been normally on the third Thursdays, and we will reschedule it for another day in November that will be better for community than that day. Any last questions from community? Okay, well, we will close as we normally close, which is with some final comments from our panelists. So why don't we start with Rachel and then head to Dr. Cohen and close out with Dr. Kasirye.
I guess I would just add, you can come to our website, we have another one, sacvax.com, where you can see our remaining flu clinics that we have planned that would take COVID to as well, and just encouraging folks to be sure to get a flu shot this year. So don't forget, need your COVID shot, need your flu shot.
Well, I know for the people who were able to sneak on this call, there were still some really good questions. And I think this remains an important issue that we look forward to having further conversations with the community. Hopefully this has been helpful. We appreciate your attendance.
And I'd like to echo that. Again, thank you for joining us. And we hope that the information that we provide is helpful. And so we will see you in November.
Thank you. And thank you to our interpreters as well.